Hello and welcome back to IowaWorks. We're joined in this section by Rob Curry with Bernie Lowe and Associates. And Rob is here to talk with us about a very important topic to unemployed Iowans, that's insurance. Rob, what are some of the options that are out there for unemployed Iowans when they're looking at insurance coverage?
Well, if you are with an employer that has over 20 employees, COBRA is an option. If under 20 employees, there's always Iowa State Continuation, which is a very similar program as COBRA. There's private insurance options for individual coverage. And then there's also government assistance programs, obviously, like Medicare, Medicaid, those types of options, as well as HIP Iowa for those that have a medical concern.
We often hear about COBRA. What is COBRA, and is it necessarily the best option?
COBRA is actually an employer law passed in 1986. It allows for an individual who is on a group insurance plan to continue on that plan for a duration of 18 to 36 months, depending on their situation. It allows them to have the same continuity of benefits, and the only negative is that they do have to pay the entire portion, which is a shock for a lot of people, especially when they work for an employer that was paying a portion of that premium. They see that true insurance cost.
Now, if I get laid off, will my employer, or is my employer required to send me material about COBRA and other health insurance opportunities?
Absolutely. They actually have a two-part notification. One, giving a breakdown of the plans and the COBRA benefit that is associated with that, as well as a notification of the current stimulus that's in effect.
Maybe you can tell us a little bit more about that federal stimulus COBRA. I know that's of interest to a lot of people.
This stimulus has been a great asset for those who have just recently been terminated from their job. The stimulus is for those who have been involuntarily terminated for their job for reasons other than gross misconduct. It's really for those that have been laid off. For them, they have the opportunity to elect this COBRA stimulus that pays for 65% of the premium cost from the onset of going on to a COBRA plan.
So really, there's a great support system through the federal government to help support COBRA for this period of time. How long does that last?
It's for individuals who are involuntarily terminated between September of last year until December of this year. And there's even talk for that program to be extended going through this economic times.
So if, let's say, I can't even afford the remainder on the stimulus package, I may not qualify for COBRA for one reason or another, what happens to my children?
Your children, obviously, people in the state want to take care of Iowa's children, so they have a number of programs set up. Obviously, there's Title 19, there's Hawkeye, there's CHIPRA. There's a number of programs that are administered at the county level that can help you really find an option for your children. A lot of the providers, in fact, have programs set aside. I've heard of one just recently with Delta Dental that is doing what's called Iowa Smiles. And that's where they're putting a number of dentists and providers together to provide dental care for those that otherwise wouldn't be able to afford that.
Rob, does it make any difference if the employer completely goes out of business and is shut down? Does that affect your implications for a COBRA coverage or something like that?
Absolutely. That's a big impact. In the rare event that your employer has gone completely out of business and they no longer have a valid tax ID, the health insurance plan associated with that tax ID also goes away. So for those individuals, they're really going to have to go for a private insurance option, see if they can go on to a spouse's insurance plan. And if neither of those two are cost effective, then they have to start looking at that government assistance model.
Now, if I feel really lost and angry and everything else having gone through this process, and I really don't understand what to do, particularly when it comes to the insurance benefits, who should I see?
Well, right off the bat, if you've just recently been laid off, contacting your company's HR, they really have a good moral obligation to send you in the right direction. In fact, if they have a group administrator doing their health plan, they might have options for you because they already know what your plan is. But if that's not a viable option for you, contacting an insurance agency, maybe the Department of Labor, those are the people that are really going to get you set in the right direction. I know independent insurance agents have really seen a large influx of individuals that are looking for new options since they've lost that group coverage.
Liz made a good comment about companies going out of business. If my company's absolutely gone and there's no one to answer the phone, who should I call?
Well, obviously you could call me at Bernie Lowe and Associates. We also have a website, www.bernielowe.com, and we have a number of licensed agents that can help you. But also just any independent insurance agency can get you set in the right direction. The key is options. Going somewhere that not only will show you the private options, but also the public ones. Not everybody's eligible for private insurance, but to maybe look at some of the state options to set you in the right direction, That's what you need to look for, somebody that's going to show you everything.
I've also heard that maybe the Insurance Commission, the Iowa Insurance Commission, is also another resource for folks. I know that they have counselors there that are working with unemployed Iowans now who might need help with insurance coverage too. So that might be another contact through either their website or their number.
Yeah, they have a great program set up. They have a frequently asked questions on their webpage, and they have the contact numbers too.
And as you see persons going through this, what's the most common mistake you see people make?
Most common thing that I've seen is looking for three things. When they look at those private insurance options, making sure that they have the access providers. You know, there's a lot of insurance plans out there, but the key is to making sure that they can go see their doctor. It may be the cheapest plan out there, but if they don't have access to their doctor, it doesn't matter how cheap it is.
Rob, thank you for some great advice. When we return, we're going to talk to a financial consultant about keeping your financial house in order. Please stay tuned.